Hello and welcome to Practice Plan Podcast. With me today is one of our regional support managers, Donna Hall. It's great to have you here.
Thank you. Thanks for having me.
Um, we're probably going to be talking about a subject that not many practices are very happy to deal with, but it's a fact of life. So we're still in a cost of living crisis, Donna.
Mhm.
How are things looking out in the field for you at the moment?
Yeah, I mean, it's definitely a challenge, certainly for not only patients' disposable income, but also cost to practices as well. And I think that's something that's getting worse, not better. So there's definitely some challenge out there for practices to handle at the moment. Patients and patients' retention on plan is definitely an element of that we need to look at.
Are you noticing that people might be considering cancelling then?
I think the cancellations for me are certainly higher than I've seen previous years. I mean, don't get me wrong, the growth of plan is definitely outweighing the cancellations, but the practices that very rarely lost patients on plan, I'm finding are having higher spikes of leavers. And that's been quite consistent really for the last sort of 12 to 18 months, I would say.
Right. So what can practices do when they're faced with this kind of situation?
Yeah, so there's two sides of it for me, Hazel. There are what do we do up to the point that a patient might think about cancelling?
Mhm.
And then what happens when they do cancel and how do we handle that? And I think it's important to define that there's two sides of it because I work with lots of practices that I'll say to them, okay, your cancellations feel a little bit high. What do we do to try and retain patients? And you get met with some blank faces sometimes. What do you mean? What do we have to try and retain them? It's what have you done up to the point that they've decided to cancel? And then, as I say, how do you deal with it after? So I would say if we start with retention, really, because people don't just kind of get up one day and decide they're going to cancel the direct debit. Yes, of course, we are in a cost of living crisis, and I think we can't avoid that. However, what I would say to any practice is that is very subjective of what patients value. So for example, I went to M&S at Christmas. I like to have a look around the Christmas food range, and the queue was the length of the shop. And I stood in there and I thought, we're not in a cost of living crisis in M&S right now, are we? And there's lots of businesses that are not feeling it. So when you've got a practice that are saying, well, everybody's skint and people can't afford it, that fundamentally isn't true
Yeah.
because it's what do you value, therefore, what are you willing to continue to pay for? There are things that we all have in life that are absolute hard. I would not give that up. I'd rather give six other things up before I give that up.
Mm.
So, what I like to try and get practices to think about is where is their dental plan in that pecking order? Because we shouldn't have patients that are cancelling their dental plan before their Netflix.
Yeah. Yeah. Yes, it's a matter of health, isn't it?
Of
And
course it
well-being.
is.
Yeah.
Yeah.
So what do you suggest that they do about that kind of thing? I mean, how do they show that that is the way things should be?
The value.
Yeah.
So it is all about showing the value. And it's no good just doing a sales pitch on a patient to get them on a plan when you first want them to join. You have to remind me every time I walk in that building why I am a member with you and what the benefit of that is.
Mm.
And that's really simple little phrases like nothing to pay today, Hazel, because you're a member of the practice.
Mm.
Not only does that make me feel lovely as a patient, anyone else in earshot that's not on a plan will be thinking, why is she not paying? I don't want to pay. And it often will get other people asking. Things like are you going on holiday? Have you got your worldwide assistance scheme brochure just in case? Because remember they've got that protection anywhere in the world. If they've got a treatment plan to pay, it's making sure we've told them that you've taken their discount off. And if you've got a patient standing at the desk and you say, oh, that'll be just X amount to pay today, quite often the patients will say, have you took my discount off? If you say to a patient before you give them the price, Donna, the price with your member's discount is, straight away they know you've applied that discount for them. Some practices will show the discount, and that for me is the absolute best way of doing it. If you can get your software to show what I've saved, brilliant. I've got others that might print a full cost off and a discounted one off. Give me both. So there's lots of ways around that. If not, it's a verbal discussion.
Yeah.
It might be that the patient's having an emergency. Now, most practices, particularly long standing plan practices, will usually see a plan patient for free for an emergency.
Right.
More recently, practices do charge, but there'll be a discounted fee. But again, we very rarely tell patients what that's worth.
Yeah.
So if you're saying to me it's free, free has no value because I don't know what free equates to. So whenever a member rings up and says, "Can I book an emergency?" Yes, of course, Donna. That would have been X amount, but because you're a member of the practice, we don't charge that.
Right.
So all of these little touch points you can do every time you see a patient, and it just keeps reminding them
Mm.
why they are on a membership with you.
Yeah. So you need to remind them of value, not cost.
Value over cost every
Yeah.
time because, if you surveyed 100 people and said, what do you feel is value for X that you buy in, we would all have a different figure in our mind. We would all value things differently, some things above other things.
Yeah.
So I think it's about the patient feeling the value.
Mm.
And it's about the touch points you do in between the visits as well. It's not just about we see you twice a year, 4 times a year, however you book them in. Do you send any kind of newsletters out? Do you do a bit of a round robin regularly with your patients? Do you do extra little competitions and things for your members? So there's lots of ways you can keep reminding me why I'm staying loyal to you. Our online portal will tell you when a patient's birthday is coming up. So there's no excuse really to not even just send a digital card or if it's a big birthday, to send a physical card because it means such a lot to patients and it's such an easy value add to do. Patients stay because they value you, but also because they feel valued. And that's the key thing. The other thing that I find you have to be careful of in practice is we don't live in a patient tolerant world where if you keep cancelling patients or you keep running late or you keep moving appointments that private members will continue to be a member with you. That kind of behaviour we see a lot more in NHS world, understandably. We've got a shortage of dentists, etc. But when we're dealing with private members who are paying you month in, month out, we absolutely should avoid having to move appointments. And that should be a last resort, not something you do commonly.
Yeah. I suppose that sort of thing undermines value,
It
doesn't it,
does.
really?
It doesn't take long for a patient to say, well, I like you and I like what you do. However, you've cancelled my last 3 appointments. I'm
Mm.
paying you a private premium for that service. I don't expect my appointments to be moved.
No. And that's a fair comment, really, isn't it, from a patient? So the worst comes to the worst, and someone contacts the practice to say, "I am cancelling."
Yeah.
What can they do, if anything?
Yeah. So, firstly, cancellations, if you're lucky, the patient will have called you at the practice and will have told you, which will give them a chance, of course, to talk about their decision. I tend to find the patients who ring the practice are actually far less likely to cancel.
Right.
It tends to be the ones that just go behind the scenes and they either call us or they cancel the direct debit, and then you just get a notification on our support portal to say, Donna's cancelled her membership. But then it's about how do we handle that?
Yeah.
Firstly, for me, that has to be a pick up the phone and call the patient. It's no good sending an email or a letter or worse, ignoring it and just cancelling them on the system. We need to know why they've cancelled and you need to know what they want to do about their ongoing care.
Yeah.
So a phone call, and I would always start that phone call with, Hazel, I noticed that you've cancelled your dental membership. Was that intentional?
Right.
You would be amazed how many patients do a direct debit tidy up, don't realise what they're paying or who's collecting that money, and they just cancel it. And we can reinstate them so easily, but we have to jump on that quite quickly.
Right.
If it is intentional, then that's where we need to ask, can I ask why? What's made you do that today? Or, can you tell me a little bit more about that decision? Because we want to make sure we understand why our patients cancel, but how we can help you moving forward.
Mhm.
And then it's a case of trying to discuss, as I say, why they've cancelled and what's driven that decision. And then we've got to come up with the solutions, haven't we? Now, of course, sometimes the cancellations can't be helped. It might be when I'm relocating 100 miles away. Oh my goodness, good luck with your move. Really, wish you well. In that scenario, contact your regional support manager and say, I've got a patient moving to this area. Can you recommend a practice that's like ours?
Mm.
We'll always try and help you, give that great service to your patients. But it might be things like, yeah, I just can't afford it.
Yeah.
Okay. "Oh, I haven't been having my appointments included in the plan," or "You've cancelled on me a number of times," or I find the biggest reason is usually affordability.
Yeah.
So then it's thinking about how you want to, what's your process as a practice?
Mhm.
Do you have a lower plan that might still be suitable?
Mhm.
Now, of course, we sell plan on health, and you should be on the right plan for what you need. But I'm finding a lot of practices where maybe their lowest plan is, say, a 2 exam and 2 hygiene model. Quite a lot now have got a 2 exam only option.
No hygiene
No
included.
hygiene. And it's not because the patient doesn't need it, it's about what do I want to budget for.
Right.
And quite often, certainly in my area, a 2 exam a year plan is around about £10, £11 a month,
Right.
which is pretty much what you're paying for Netflix or Disney or whatever else you subscribe to. So it's having a lower option, even if you don't advertise that, that you can use in this scenario if you're comfortable with that.
Does that go down well? Because it means might a patient think, well, why wasn't I on that previously?
It goes down well because it's great for new patients. Because when you're on the telephone trying to sell the new patient dream, so to speak, being able to say we do a membership from £11 a month, actually, if I'm shopping around, you're likely to be one of the cheapest plans in your area.
Right.
If I was a patient in that scenario, Hazel, where you say, well, look, I have got something else I can offer you, it would be a conversation being really clear in saying that will not include the hygiene visits you've been having, but it will mean you remain a patient with us, you still get all the other benefits,
Mm.
and then you will need to pay for that hygiene as and when prescribed.
Right. Okay. So I suppose the benefit to them is that their oral health is still being monitored.
Absolutely.
Yeah. And anything can be picked up early if it
Yeah.
needs doing.
What you find quite often is patients will say, I just want to come and pay each time I come.
Mm.
And, with the best will in the world, Hazel, we all think that we attend every 6 months, and pay as you go patients fall into kind of the worst attenders quite often
Yeah.
because they are the ones that are having to pay on the day.
Mm.
Life gets in the way, you're driving to work and your tire blows out, or, you suddenly need a new boiler, or something crops up that means you've now not got that disposable income.
Yeah.
So you find with pay as you go patients, they end up coming about every 7 to 9 months. So they start to attend less frequently, which of course means longer between appointments, more health risk. But also, if then another practice opens down the road that maybe gets an NHS contract or whatever, they're not bedded into you, they're not secure.
Mm.
So they are more likely to drift away and you just don't see them. You can't make a pay as you go patient come.
No.
With a plan patient, they're paying. Why wouldn't they come?
Exactly. They need to get their money's worth, don't they?
Yeah.
Yeah.
And then, once you've kind of established the why, talked about any other solutions you might have, it's making sure the patients know what benefits they're giving up.
Yeah.
So just before we cancel you, Donna, I want to make sure that you know all of the benefits we give you on the membership that you will no longer get as a pay as you go.
Mm.
And then what do you want to do about your ongoing appointments?
Mm.
If they're remaining with you, well, all of a sudden now that appointment in a couple of months' time is going to be a pay as you go appointment. Do we need to take some money for that? What's going to happen?
Yeah.
So it's a real process. And this is why a phone call works so much better than an email.
Yeah. And does that often help that you manage to sort of retain the patient?
Definitely. And I think if even if it doesn't keep them on the plan always, Hazel, it does give you that chance to find out if there's something wrong that you didn't know.
Yeah.
Or and put it right, of course, but also it very often will end up in the patient staying with you, even if it is on a lower plan or a pay as you go. Or quite often they'll rejoin the plan and you'll keep them on that.
Right. Okay then. So there's hope then.
There is definitely though. I think it's just about being, you know, having a process in the practice for following up your cancellations. Don't give that job to somebody that absolutely hates making those calls
No.
because they will call them, tick a box and say, I've tried, they didn't answer.
Yeah.
I would also keep a tracker, a spreadsheet or a Word document, whatever you prefer, with every single patient cancellation you get and the reasons why.
Mm.
Because when you look at them in isolation, you will forget the trends.
Yeah.
When you look at a whole 3 months of cancellations, quite often you'll see reoccurring themes.
Right.
And then that gives you a chance as a business to reflect on what we're doing. Is there something wrong here? Is there treatments we're not offering? Actually, have we got Heather's been an awful receptionist, he's been really rude to people. It will highlight what's happening, but you need that as a business to grow.
It might be uncomfortable, but it's what you need. Yeah,
We need to know the facts, don't we?
we do indeed.
Yeah.
Well, that's great. Well, thank you so much,
Mm.
Donna. I think that's brilliant advice for people, and I hope that they are able to take it and make use of it.
Thank you. Thanks for
Thanks.
having me.